Hello, welcome to our presentation. Our goal today is to help you understand the importance of your oral health journey. We hope this presentation is informative and helpful. We appreciate you taking the time to join us today. We are a group of senior dental hygiene students at Northern Arizona University. This is our capstone project, and we wanted to help with focusing on veterans as a group. We know that you have made a lot of sacrifices while serving our country, and we wanted to do something for you in return to help you reach good oral health goals and hopefully create a better quality life because of it.
Please take a moment and pause this presentation to take our pre-presentation questionnaire.
The objectives for our project include describing the link between oral and systemic health, explaining the benefits of preventative versus emergency dental care, identifying barriers that limit access to dental care for veterans, direct others to resources for eligibility and enrollment of Medicare, and lastly, recommend resources for local dental clinic options available for veterans like you. In order to understand the motivations for human behavior, we must look at Maslow's hierarchy of needs. In the second tier of the pyramid, you'll notice health, which falls under the umbrella of safety and security. Without sound physical health, which does include teeth and the oral cavity, human beings are unable to focus on the more important things in life, such as self-actualization or reaching goals and creating meaningful relationships with other human beings. So some of the greatest barriers to care, which prevent several populations actually from being able to access dental care, include the financial aspect or the cost of treatment and services, lack of motivation, fear, mental health, and lack of education on the benefits of dental care, which are readily available to you. Did you know the mouth and body are in fact connected? With the presence of bacteria and disease remaining in the oral cavity untreated, these oral manifestations have nowhere else to go other than travel to the body. Oral manifestations, such as the presence of inflammation, can translate into cardiovascular issues such as high blood pressure and heart attacks. Additionally, the brain, the kidneys, all of the images in the photo, lungs, and pancreas are all connected parts of the body, which have the risk of becoming affected by oral disease as well. And you'll notice on this slide, we have attached a diagram, which is an additional visual representation of how poor dental hygiene can affect your overall health. Again, we can see how oral manifestations can progress into serious systemic disease. Conditions like diabetes, heart attack, respiratory infection, premature birth, and even cancer.
The presence of poor oral health can be seen in various degrees throughout the mouth. It can be as simple as having consistent bad breath, which indicates that bacteria is beginning to get to an uncontrolled level. Some other signs that you may notice are going to be tooth decay, also known as cavities. Pain in the mouth can also be present as well. Please note that these signs are common when an individual does not take care of their oral health, can also come from other factors such as medications. Therefore, all things are important to evaluate and take into consideration. When these signs are not addressed, they can lead to oral conditions that can be difficult to manage without the proper habits. Periodontal disease or gum disease is one of the most common oral conditions affecting about 50% of the United States population. When gum disease is present, we start to see things like bleeding and inflamed gums, bone loss, and recession. In severe cases, it is even possible to experience tooth loss. As you can see on the right side of this slide, the top image shows the early stages of gum disease, where we see mainly redness, inflammation, and bleeding. In the bottom image, it is more severe stage, where we see significant recession with bone loss and a higher chance of teeth that are loose or missing. Now that we know the importance of the oral systemic connection and what signs can develop in the oral cavity when bacteria or disease are present, let's take a look at some different options for finding a provider in your area or just the proper benefits to help cover some of the cost. First, you can ask your primary care physician if they have recommendations of dental offices that you could go to in order to receive care. Next, if your employer provides insurance benefits, you can ask what options are available in order to obtain a dental plan. And lastly, you can do an online search for dental schools or hygiene schools in your area. A lot of the school clinics provide low cost care or even free care to the public. So as we sit here and tell you the signs to look for when care is needed, why seeking care is so important, and how to find it, we need to be able to differentiate between receiving emergency care and preventative care. Unfortunately, a lot of individuals wait until they have some sort of pain in their mouth to seek care, and they usually don't see a dentist first. They seek care from the emergency room. Emergency room visits cost about 3 times more than an emergency visit to the dentist, and prices can range anywhere from $400 to $1,500 with each visit. That's a huge difference considering that a dentist can only range anywhere from $90 to $200. And this leads us to why seeking preventative care is so important.
So what can be done to keep the cost of dental care to a minimum? The best thing is preventive care. Just like making sure you are eating right and exercising for overall health, you want to keep your mouth healthy. Brushing twice daily with a fluoride toothpaste and cleaning between the teeth daily is essential. Brushing should be for 2 minutes each time. And when it comes to cleaning between the teeth, we're talking about floss, the floss hooks, interdental brushes that clean between the teeth that are similar to toothpicks, or a water pick. There's no set rules about when to floss. It can be in the morning, the evening, or 3 in the afternoon. It just needs to be daily. We also want to make sure we're limiting exposure to acids. Acid exposure erodes the enamel and it increases your risk of cavities. You can have things like soda, coffee, energy drinks. It just needs to be for short periods of time, like 20 minutes, and then drink water. You don't want to sip on those for hours at a time. Seeing a dentist twice a year for checkups allows problems to be identified early on. Adding a mouthwash to your routine may help as well. They reduce the amount of bacteria in your mouth, which helps to keep it healthy. It's not recommended to have any oral piercings as they increase the risk of chipping or breaking your teeth. There's also a risk of them getting infected, and that can create a lot of discomfort with eating and talking. In this age of social media and mail order everything, make sure to discuss any do-it-yourself dental treatments that you hear about or see with a dentist. There are many products out there that have not been given FDA approval, have not been approved by the American Dental Association, and don't have any research to back up their claims. As you're working to take care of your mouth, routine will be key. There is no set routine you must follow, but it is recommended you brush about every 12 hours to disturb the bacteria in your mouth and remove debris. People work different hours and have different responsibilities, so that's the easiest way to look at it. Like mentioned it before, flossing can be done anytime, and it doesn't even have to be done when you're brushing. Keep in mind, it takes about a week of daily flossing for bleeding and tenderness in your gums to improve. You can't give up after 1 or 2 days. Flossing daily is the goal, but don't get overwhelmed by that either. Start with a small goal. You're going to floss Monday, Wednesday, and Friday, or find an activity to attach it to. Every day you work, those are the days you floss, or in the days you go to the gym. The military already gave you the foundation for routine and discipline. You just need to take those tools and apply them to your oral health. Remember, the goal is regular home care, checkups twice a year, and saving yourself money by fixing problems when they're small. Doing these small steps will help you retain your teeth through most of your life. This will lead to a healthy mouth and body that gives you a better quality of life. Our goal is to have you eating steak into your 90s because you still have all of your teeth instead of missing your teeth. We know that not everyone has access to dental care, or you can be unsure of where to find dental insurance. You can check with the VA to see if you are eligible for dental benefits. Your civilian employer may offer dental insurance as well. If you're retired from the military, you're eligible for FedBIP. And if you have recently retired, you should be able to apply immediately for it. But if not, the enrollment time is in the fall. In Arizona, there is emergency coverage with Medicaid, but that's something to discuss with your Medicaid representative. Something a lot of people don't realize is that insurance is not required to see a dentist. Dental visits can be affordable, and a lot of offices offer discount plans or cash discounts. There's also local dental and dental hygiene schools that offer affordable options as well. And we have an attached list with those resources in a future slide. If you are looking for a dentist, a great place to start is by calling your insurance company or checking their website to find someone near you. You can also ask friends who their dentists are and call their office to see if they accept your plan. And I know it's overwhelming, but you can go on the VA website and apply for dental benefits, and they'll let you know if you qualify. The FedVIP website is where to look if you've retired from the military.
Who qualifies for dental benefits through the VA? Here's a video from the Department of Veteran Affairs YouTube channel to explain this criteria.
Hello and welcome to another episode of the SIDREP. Today, Mike and I would like to discuss VA's dental program, more specifically, who qualifies. We will cover 9 different ways most veterans are able to qualify for VA's dental program. And if you are a veteran that does not meet any of the qualifications, don't fret. In a later episode of the SITREP, we will be discussing how you can get dental insurance at a reduced cost through VA's dental insurance program. So be sure to subscribe so that you don't miss out on that episode. Now, how do veterans qualify for VA's dental program? At number 9 are those veterans who have a service-connected compensable dental disability or condition. Veterans in this classification will be able to receive any dental care that is needed.
Next up, at number 8, are veterans who are former prisoners of war. Again, these veterans will also qualify for any dental care they may need.
At number 7 are veterans who have service-connected disabilities rated 100% disabling or are unemployable and paid at the 100% rate due to service-connected conditions. These veterans are able to receive any care they may need, but please note that temporary ratings of 100% are excluded from this, such as those who are hospitalized for an extended amount of time and similar situations.
At number 6 are veterans who request dental care within 180 days of discharge from the military. Veterans under this classification qualify for one-time dental care if your DD 214 does not indicate that a complete dental examination and all appropriate treatment had been provided prior to discharge.
Next is number 5, which are veterans with a service-connected, non-compensable dental condition or disability resulting from combat wounds or service trauma. Veterans under this classification will receive any care necessary to provide and maintain functioning dentition.
At number 4 are veterans with a dental condition clinically determined by VA to be associated with and aggravating a service-connected medical condition.
Number 3 are those veterans who are actively engaged in the Veterans Readiness and Employment Program, also known as VRNE. For specifics regarding this classification, be sure to check out the link in the video description below.
At number 2 are veterans who are receiving VA care or are scheduled for inpatient care and required dental care for a condition complicating a medical condition currently under treatment.
And number 1, those veterans who are enrolled in a qualifying VA-sponsored homeless residential rehabilitation program for at least 60 days. Again, as I said earlier, if you do not qualify under any of these classifications, you also have the option of requiring dental insurance through VA's dental insurance program. To learn more, be sure to subscribe, as we will be creating additional content on this topic and many others.
Medicaid coverage is different in each state. In Arizona, Medicaid currently does not cover routine dental care. However, emergency dental care is covered and it is capped at $1,000 per person annually. Arizona residents can use this QR code to access more information about application submission and enrollment. Dental hygiene school clinics are a great resource when looking for preventative dental care options. Northern Arizona University, Carrington College, and Phoenix College are just a few dental hygiene schools in Arizona that offer preventative and therapeutic dental care. You can go online and research a dental school or dental hygiene school near you, or you can review our handout that will be available in the next few slides. In the Flagstaff area, we have Northern Arizona University, which has a dental hygiene clinic. They are community partners with Smiles for Veterans and offer free preventative dental care for veterans over 60. Use this QR code to find out more information about NAU's dental clinic. In the Mesa area, we have Carrington College, and they offer a free dental hygiene clinic. Use this QR code to find out more information. In the Phoenix area, we have Phoenix College. They have a dental hygiene clinic as well. They offer a free 60-minute assessment and a $35 flat fee for treatment. Use this QR code to find out more information. We have compiled an extensive list of dental clinic resources by area for the state of Arizona. You will find a complete list of dental hygiene schools, dental schools, reduced fee clinics, mobile clinics, free clinics, and nonprofit organizations. Use this QR code to access and print our list. There are nonprofit resources to increase access to care. Smiles for Veterans advocates for Arizona veterans and increases access to care with community partners. You can learn more about this organization by scanning this QR code, or you can also call or email them for more information. Here's a news report highlighting Smiles for Veterans and how life-changing their work can be.
WMAR2 News is your voice for veterans, and one veteran is all smiles, but that wasn't always the case.
Yeah, Army veteran John Jackson wears dentures in place of his upper teeth, but he won't have those for much longer. Akiso Oral, Facial, and Dental Implant Surgery in Lutherville picked John for their Smiles for Veterans program, meaning he'll get $50,000 permanent implants for free, and he'll tell you a new smile is priceless.
I won't be self-conscious about whether or not I'm going to gag in the middle of a conversation or have to take the dentures out because I can't eat properly with them in. So yeah, it definitely changes my quality of life. It'll make me the person I was normally. I like to socialize and I like to go out and have fun and smile. And I don't do that as much now, and I'm looking forward to getting back to it.
Oh, I'm excited for him. John says his family is almost more excited than him since he can stay at the dinner table a little longer now. He's also looking forward to eating a nice big steak as soon as he can chew again.
Oh, I'm so excited for him. And for more stories impacting our veterans, head to WMAR2news.com/voice for veterans. And if there's a story that you would like us to know about, just email us at storyideas@WMAR.com.
We hope you found this presentation informative and helpful in connecting with access to dental care options. We would like to humbly thank you for your service and your time watching our presentation today. If you have any questions or feedback you would like to share, please email us at scm294@nau.edu. At this time, we would like you to take out your phone, scan this QR code, and complete our post-presentation questionnaire. I'll take a moment to go over our reference slides briefly. This concludes our presentation. Thank you again for joining us.